Hey, mom friends! This is Functional Medicine for Moms, where we look at motherhood through the lens of functional medicine. I'm your host, Kelly Moline, a pharmacist with advanced training in functional medicine. From pregnancy and postpartum to everyday parent life, we talk root causes, natural solutions, and real stories from our own family's journey, plus conversations with experts along the way. Hey, mom friends, welcome to another episode of Functional Medicine for Moms. I'm very excited for today's special guest. I have Dr. Jordan Stafford with me, soon to be Dr. Jordan King, and she is a doctor of chiropractic and a holistic chiropractor. So it's a little bit different than the whole cracking backs thing that we typically think of with chiropractic care. And she really focuses on healing the mom so that the family can thrive. So today I have Dr. Jordan, and she's Doctor of Chiropractic who is currently practicing in Golden Valley, Minnesota at Vibrant Health Center. She is passionate about helping moms and families nurture their emotional and physical well-being, uncover their purpose, and step into the lives they are truly meant to live. Aside from being a chiropractor, she is a new mom to her 7-month-old son, Louie. So we have babies pretty close together too. So that's fun too. Both first time moms. So welcome, Dr. Jordan, and tell us more about yourself and what has led you to be a holistic chiropractor.
My name's Dr. Jordan. I kind of grew up in this crunchy world. So I'm a daughter of like an OG crunchy mom. She also like rubbing essential oils on our feet, making different home remedies, things like that. And so in our family, we never viewed sickness as like a bad thing. We always knew, my mom always said, like, trust your body, it's doing what it's designed to do. So when we were sick, it was always just like, okay, we need to support our bodies the best way we can and
Yeah.
whatever like. I always like loved being sick. Not, okay, I didn't love it, but like I enjoyed being sick because I got to stay home with my mom and she would like take such good care of me and my siblings when we were sick. So, and I think she like loved doing that too. So it was always just, I mean, I grew, yeah, like with this idea of our bodies are, designed to heal themselves. Um, that led me to, in high school, I loved exercise. I loved sports. I loved nutrition. So I always thought I'd be a nutritionist growing up. But that kind of didn't happen. I went to school for exercise science. There's not much you can do with an exercise science degree. So
Sure.
when I, yeah, so when I graduated college, I worked at a hospital as a cardiac technician. I loved the people I worked with, but I just didn't love the job. I always knew there was something more to health and healing. People weren't getting better. They weren't happy with like our care that we were giving. I was seeing a chiropractor at the time and he was like full of life and he loved his job. And I was kind of inspired by him. So I kind of was asking him, like, where'd you go to school? Like, how do you become a chiropractor? And he was like, you should totally do it. And I was like thinking about it. And it was the only doctor that I went to where I got there feeling like crummy and I left feeling really good. So that's what I loved about like the idea of chiropractic. I applied for school and I got in, and then here I am, a chiropractor. Um,
Yay.
yeah, so that was kind of my journey.
Yeah, fantastic. And what led you to be, I guess, a more holistic chiropractor as well? Chiropractors, I think, in general, tend to be more holistic, but I think you do more than what you think of like cracking backs and just moving on from there. Tell us more about that.
Yeah, so holistic just means that you look at the body as a whole, right? So sometimes you go to the chiropractor, you have neck pain, they crack your neck, and like it feels good, and you're on your way. For me, as a holistic chiropractor, I take a step back, and I really look at the body through the lens of the triad of health, which is I look at structural imbalances, chemical, nutritional imbalances, and then emotional imbalances as well. So for example, if someone came in with shoulder pain, like say, I have shoulder pain, instead of just going to their shoulder and like figuring out what adjustment do they need or like what muscle is imbalanced, I take a step back and I look at what could be causing their shoulder pain. Um, the shoulder, there's a muscle in your shoulder called the deltoid. The deltoid is related to your lungs in Chinese medicine. So, um, so is there, a bacterial infection that's affecting their lungs that's causing this shoulder pain or this deltoid muscle to like shut off or not work essentially? Is there fungus within their lung that's affecting it? Were they exposed to mold as a child? Did they live in a moldy home and it's affecting their lungs? That was actually part of my healing journey, mold. And then to go even a step further, the lungs are related to the emotion of grief, sadness, or loss. So, uh, if someone comes in with shoulder pain, a common question we ask is, have you experienced, death of a loved one recently or death of a pet? And usually the answer is yes. And they're like, wow, like I didn't know, the death of my dog could cause me to have like frozen shoulder. So that's kind of the difference between, like holistic. So I'm viewing the context of a shoulder from like a higher viewpoint or just taking a step back than, assuming that it's just like a structural problem that there needs to be an adjustment or like muscle work on this shoulder to release the pain. That's kind of,
Yeah.
yeah, holistic view versus just regular, I guess, chiropractic, which is both great. Any
Yeah.
good chiropractic. So
Wait, I love that. So when you see someone, let's say for shoulder pain, and you think of the lungs and you think of grief and sadness, what does it look like from there?
yeah, so when people come into my office, I always ask them like, "Hey, is there anything new I should know about you before we start?" And they'll usually like say, "Yeah, I have back pain or whatever it is." I see a lot of like skin wrap. Well, let's just stick to shoulder pain. So say they have shoulder pain. Yeah, I always just take a step back and um I kind of view myself as like a vessel. So I know a lot of things. I went to school for many years and I think I could figure out what's going on with this person, right? But I'm not smart enough to know exactly what this person needs. So I step back and I think, how can, I be used as a vessel and how can their body reveal to me what it needs? Um, I use a technique called applied kinesiology muscle testing. So it's a biofeedback tool. So we get information from your body in real time. So kinesiology is the study of muscles and movement, and applied just means you apply that to real time. So I use applied kinesiology to go in and see what does this person need in the correct order, because we say a good thing done at the wrong time is still the wrong thing. So there's always an order that
Yeah.
our to work through things.
Hmm.
Um, if we, yeah, we can't just give this person like a million supplements and be like, good luck, we
Yeah.
like do things in a specific order as well.
I have the same thing with my practice too. When we're talking about, cortisol and gut health and detox, if I just like full on do a full detox on you, but we didn't do the prep work, you're going to feel way worse. So we have, yeah, we have a lot of that same thing. And same thing, like I'm working a lot with some like chemical imbalances, right? But I don't get into the structural thing like you do, like a chemist at heart as a pharmacist. So seeing how it can also apply to like the structural and the muscles and everything like that sounds really cool. And it makes sense because the body is working so much as a whole. So to be able to have people like you to be able to see that and to help fix it in more of a natural way
Right.
without maybe like jumping to surgery can be life changing for so many people too.
Yeah, and you can't influence one. Like I can't give an adjustment without influencing the chemistry of someone's body. I can't give an adjustment without influencing the emotional well-being of someone's body. And I think a good chiropractor understands that, even if they don't necessarily work specifically with the chemistry or the emotional stuff. Um, knowing that they are still affecting that part of the person's body is huge. So, yeah.
Sure. Can you go a little bit more into that triad
Yeah.
and how you said structural, emotional, and chemical, right? Influences each other.
Yeah. So, the triad of health, it's an equilateral triangle, meaning they're all equally as important. So, on one side, we have structural imbalances, like you could say misalignments in your spine, or maybe there's some muscle weakness, or muscle injury to the muscle. That would be like structural thing. Chemical, nutritional things would be like, I think I mentioned it. So like mold, parasites, um, like leaky gut types
Yep,
symptoms.
know that well.
Yeah, expert in that. Um, let's see. So, and then nutritional deficiencies. So, like vitamin C or magnesium, things like that, zinc. And then the other side of the triangle is the mental emotional aspect.
Hmm.
Um, so that would be like, I mean, I use a technique called neuro-emotional technique, which we can get into, and I think we should get into, but that's often overlooked in the Western side of medicine, but it's so important to address because, yeah, again, you can't influence one without influencing the other. And it goes back to like the whole holistic thing. So I view every patient's complaint or symptom or condition through that lens of the triad.
Amazing. So, explain more the emotional side. I think we kind of have an idea, a lot of people with the structural side going to a chiropractor. I have a better idea with like the chemical side, with, adrenal cortisol imbalances, we have the gut health, we have the supplements, and now emotions play a big role. Obviously, when I see someone for cortisol imbalances, sure, I can try to balance that, but if we're not getting to the root of why we have that cortisol imbalance, it's going to end up, in the same place. So, talk more about that.
I think so. When I talk about emotions, like I'm so fascinated and passionate about this side because it's the thing that helped me the most in my healing journey too, was addressing like those deeper imbalances and traumas almost that happened to me like years and years ago that I was holding on to throughout life and I didn't even realize it. And it was affecting how I interacted with people on a daily basis. It was interacting the way I was in like relationships. So I am very passionate about that aspect of the triangle, you could say. But a really good quote is, our organs weep the tears our eyes refuse to shed. So our emotions live in our physiology. They're not in our head, like we think of them just all in our head. They live in our body. So it's been mapped out for thousands of years in Chinese medicine. I mentioned our lungs are related to grief, sadness, loss. Our kidneys are related to fear, and our bladder is related to overwhelm. Our bladder is the holder of all unresolved emotional trauma. Um, Our stomach is related to worry or anxiety, low self-esteem type issues,
I
like
think people feel that one.
they can feel that. Our liver is related to anger. So you think of like an alcoholic, like they're angry. Our gallbladder is related to the feeling of galled. That's literally where we get the term gallbladder, is the feeling of galled, and galled is like a or like annoyed feeling, and so on. So all of our organs are connected to different emotions. I use a technique, it's called neuro-emotional technique, or NET for short, and it's a technique used to go in and kind of unlock or find those emotional stored patterns that we've been holding on to and bring them to the surface so that you're able to let them go. So it's different from talk therapy, where we're just kind of like expressing or maybe talking about like how we feel. Like this actually gets to the physiology of the emotion to be able to surface and let go. And the way emotions work is whatever we don't let go of in life, we suppress, we repress, we shove it down until it gets expressed in the form of disease, dysfunction, or behavior that we don't like. So there's a good quote by Woody Allen who said, I don't get angry. I just grow a tumor instead. And that's very, so, so shoving down these emotions will just lead to dysfunction of that organ eventually down the line. Um, yeah. And that's a little, I guess, synapse of how emotions can affect our body.
So don't suppress your emotions. Okay, so I
Yeah.
have to say, and I have to ask you this with the mom going, okay, you kind of lost me there. This feels very woohoo. Can you share more on maybe don't want to say share more of the science because I'm sure there's a lot of science backing it as well, but can you share more to that mom who's like, I don't know about this?
Yeah. Neuro-emotional technique, they're very big on the science. Like they don't, I was just at a conference this past weekend. They don't teach us anything that can't be backed by science. So they've done scans of your brain. They've done MRIs of people before and after any neuro-emotional technique, and it's like crazy how much it affects your brain. There's actually an episode of Grey's Anatomy where they do NET too. I don't know what it is, but they do NET in that. Um, yeah, and to that, like we get that a lot. Like we do a workshop every month, and there's always someone in the crowd that's like sitting there like this, and they're like prove to me, and I I'm not here to like prove anything or like if you if you don't agree with it, like I think you should experience it and then you probably will agree with it.
Mm-hmm.
Um, but I think truth is self-evident. Truth reveals itself always. So I think to them I would just say, try it. Like be open-minded, like what it's not going to hurt you, right?
Yeah,
Uh,
exactly.
yeah.
No, I like that. There
Yeah.
is a lot of science, I think, behind this more older medicine. I think the allopathic and the Western medicine is honestly very new compared to the Eastern medicine, the functional medicine, the Chinese medicine. That's been around thousands of years. And we have our synthetic medications now that honestly is a lot newer. So, one, there's like a lot of history behind it, but then people have done a lot of studies to show it as well. So, just things to keep in mind.
Yeah.
Okay, so you've talked about what happens when the emotions are being suppressed. Let me get into my notes and my questions. Can you share changes you see when emotions are released and the nervous system is balanced? And can you share an example of what that looked like, maybe with some of your own patients or experiences?
Yeah. I even did, so in our clinic, there's 4 doctors and we treat each other all the time. We're always like working on becoming better doctors. And each day I treated one of the doctors and he was struggling. It was related to like feeling unworthy or feeling like he's always saying the wrong thing or trying to prove something. And it actually stemmed back from it stemmed to his father, like his father not fully supporting what we do and him always trying to prove to his dad. And the release was kind of crazy. So the room got really hot and you can feel like the heat coming off of people sometimes. A lot of people will cry. That's very common in our office. We go through lots and lots of tissues.
Wow.
Yeah.
That's incredible. Let's bring this back to like the mom perspective. Have you helped moms in that same standpoint? And can you share how this can help benefit moms as well?
Yeah. There's a good saying in Chinese medicine, treat the mom for the family. And I think so we are like deeply connected to our children. I mean, we grew them in our womb for 9 months, and I don't think that ever goes away, that connection. But it's happened over and over again where I mean, I treat some of my friends too, but my mom friends, but where the kids are kind of acting like a little crazy or maybe out of the ordinary, and I start treating the mom, and then there's like a 180 shift in the kids' behavior.
Wow.
And that happens. I think of this one mom. She came in and she has 4 kids, seeing her son for the very first time. And she came in and she was stressed. You could feel it. She was up here. She was in that sympathetic state. She was very, fight or flight. And I was like, hey, I think you need to be treated and like take care of yourself. And I think that's going to make a major shift in your son. And she was like, oh, yeah, I have an appointment tomorrow. And so she came in. She was seen by a different doctor. She was treated. And the next time she brought all her kids in, it was like insane the difference that I noticed in just their whole family. They were all more relaxed, more calm. It wasn't as crazy and chaotic. She looked happier, her kids looked happier. And like we see that over and over and over again in our office is treating the mom and the shifts that happen within their kids, which is
Yeah.
really, yeah.
Yeah. And I think as moms, we naturally prioritize our children, our babies, our, our spouse, and then at the end of the day, we have like zero time and energy for ourselves. And we kind of get into this like snowball effect of, well, I'm last on my list. And I try to tell people, put yourself at least in the top three. Like, I know that there's other things that need to get done, but, the dishes can fall underneath you, right? Like, I know there are other things. So,
Yeah.
yeah, I think that that is really powerful. And how the children and the family just reflects from the mom and
Yeah.
shadows that. And I think obviously, like an emotional, we can think of when we're young and our mom, if they're not very regulated, how much like you feel that too. And so, same kind of thing. Obviously, we're talking about like co-regulation with our behaviors, but then just in a different standpoint, like this emotional, structural, chemical aspect can all affect your family too.
Yeah. I think the best thing we can do for our kids is take care of ourselves for sure. We are the heart and the soul of the home. It's just taking care of yourself. Yeah.
Yeah. Okay. And so you're a new mom as well. So how have you applied this with your own motherhood?
Yeah. I think becoming a mom, it kind of almost forces you to have faith and like grow your faith because you have no other choice, right? Like we don't want, as moms, we don't want our kids to be sad. We don't want our kids to experience trauma. Um, if we could, we'd probably like bubble wrap them and like keep them forever, but we can't do that. That's not realistic. Um, Life happens for us and we can't control those things. And so I think the biggest thing was just um, surrendering to that and just having faith that, God has a plan for him and it's out of my control. And I think that's like the coolest part of motherhood is how important it is to have faith and to surrender in those things that you can't see. And you can, I think you can't really have healing without faith. I think healing is an inner journey. It happens within. It's that inner shift of environment. It doesn't happen out here. Um, and it's that recontextualization or that having faith and trusting in the things you can't see. So that's been a big thing for me is just the whole faith journey. I think going from like here to like kind of to like, oh yeah, like this is real. Like I need this almost.
Yeah. And even I experienced that a lot in pregnancy. And even the getting pregnant part took a little bit longer, especially with like my miscarriage and stuff too. There's so much you can't control. So you have to have that surrender and know that God has a larger plan for you. And then preparing for the birth, right? Like it can be so scary. And I think, as a society, want to control more of that too, right? Birth has become a big business for a lot of hospitalizations, and we have everything kind of planned out. And then, but there's this other side of birth that is beautiful and instinctual and primal, and just like surrendering
Yeah.
that is when people are able to like give birth naturally if that's their goal, but you have to be able to surrender because the more you fight that, it's not going to work well and you're going to have so much more pain. And that's like a good, I don't know, good method of just explaining it, how in life that can be very similarly. And then having the baby and having this newborn, you have to really have that faith that everything's going to be okay with them because you can put all the little machines on them to make sure that they're still breathing, but like you have to have a lot of that faith with that too. I agree. And when I like see patients and I find that the patients without that faith and that spiritual health, I can do a lot of things chemically, but they seem very like spiritually lost, which is much harder in my opinion to help.
Yep, I agree with it. It is so much easier working with people that do, trust and surrender and have faith, have some sort of faith. Yeah. Almost them getting out of their own way and allowing their body to heal. And when they have faith versus if they don't, it's like their own blockages that are getting in the way of them actually healing. So
Yeah.
I
Yeah.
totally agree. Yeah.
Because we have our physical body, we have our soul, and we have our spirit. And so it all affects each other, obviously.
Yeah.
Yeah.
Mhm.
And you also like to talk about helping people, I think, find their purpose, right? Is that what you mentioned? And how that can affect health as well?
Yeah. I think I'm really passionate about uh, helping people find their purpose in life because I've kind of been on this journey myself of, letting go of past stories or maybe past characters, um, past identities of like things I told myself, like, I'm the person that's shy or I'm unconfident, and that's the story I was replaying over and over again, and it was getting in the way of my own growth, not only a practitioner too. And so, letting go of those things, it was very scary, and there's a lot of uncertainty beyond that because you don't know, like, that there's potential of becoming, the best version of you, but it's kind of like, I don't know why I'm scared of that. Like, I like holding myself back from that. And I've been on this journey for many years, and um, it's really hard. It's that's why they say the healing journey is very difficult. It's not an easy process. Freedom that you experience once you do, get there is like unmatched. And I just want like everyone to experience that, I guess. And just knowing like there is more than like suffering. Like you don't have to suffer, and like you can be free to express your true self. And this is maybe like sound crazy, but like coming home to yourself and remembering like who you truly are. um, we're told a lot, like, just be yourself. And there's many years where I'm like, what does that even mean? Like, what does it mean to just, what do you mean be myself? Like, I don't even know what that means. And now it's like, I actually know what that means, like, and what that means is very, yeah, freeing. And I just want every mom to have that.
Yeah. No, I love that. Okay. So there's a lot of moms out there that may be still on their journey to finding themselves. They're trying to figure out their own health while managing their little kids' health, right? So for
Yeah.
that overwhelmed mom trying to have some key takeaways from this episode, what are some things that they could get started on now?
Yeah. So it's like, what do I need to be doing to help my kid? What do I need to be doing to help my health, my relationships? And letting go of all of that and just going inward to yourself. Really, like opening up to whatever's inside. I think a lot of almost like scared to face those things. And all of the answers that you're looking for are not out here, but they're inward. They're here. So just kind of shifting all of the things I need. I am whole as I am. All the answers I need are within. For me, it's just being alone and like I'm really big on meditation. So getting rid of that will eventually align you with what you want in life. But it's all of the answers are within.
Yeah. There's a lot of noise, I think, that we're being served, especially now with social media and our algorithms and all of that. We
Yeah.
have a lot of noise.
There's so much information too. Like you go online and there's so many influencers that are trying to influence you a certain diet or a certain supplement, a certain workout regimen, and it's like, where do I go? Like, but another thing that helped me too was all these techniques and things, they all work, but it's your belief and it's your conviction to do that.
Yeah, for sure. And I tell people too, like, as much as I'm passionate about helping you, it doesn't work if you don't want to help that. And I need, like, I'm giving 100%, but you also need to give 100% for this to work. It's always a 200% type of program.
Right. That's the first step, is wanting to get better, because that's a real within people, is people don't want to get better. Like, their things are their things, and that keeps me, that gives me an excuse, or um yeah, it's like a crutch almost, but you have to want to get better. If you don't want to get better, you're not going to get better.
Hmm. I see that with even diagnosis that people receive. They're like, oh, yeah, well, I have these genetics that I really can't overcome because it's genetic. Like, yeah, genetics may load the gun, but your environment and what you're doing pulls the trigger. So, yeah,
Yeah. I actually don't love giving labels to people, because then it's like, yeah, I have Hashimoto's, so that means I'm always going to be tired and fatigued, and
right.
I'm to lose weight. And it's like, no, you're not subject to that. There's a good saying, we are only subject to what we hold in mind. So our thoughts are so, so powerful. And if you keep repeating, I have this diagnosis, or I have this, and that makes me this way, like, then that's going to be true for you.
Yeah, for sure. So what daily practices and small actions can people do? I know you talked about meditation, which can be really powerful. What can we do in our day to I know now we're talking about the doing, right? Which you just said stop talking about the doing.
Yeah. I think the biggest thing is just getting outside, getting in nature, grounding yourself. Um, it's if you feel down, or, if you feel like blah, like, get outside, go for a walk, and then, like, let me know how you feel. Like, you're gonna feel so much better. So I think getting outside is so important. Um, I take baths. Like, I am like, honey, you take the kid. Like, I'm gonna go take a bath. Like, Cody knows at that point, like, okay, like, she needs, time just to be, like, with herself. I think it can look different for anyone, but it's just kind of reconnecting with yourself, I think, is the biggest thing that's gonna help people, with that, like, rest, digest, heal state, instead of, like, being up here. So there are many different techniques online that you can use to get into that rest, digest, heal. Get it on a regular basis really supports your nervous system.
Yeah. And things like this can work together holistically, right? We're all thinking about the whole body as much as we can. And so, like you said, with the triad of health, how it all just relates to each other, whether you're like seeing functional medicine for supplements and stuff and getting that chemical, you're seeing chiropractic, or you're seeing some sort of like physical healer, and we have, the emotional standpoint as well. All of that can work together. They can also see you, which you focus on a lot of that as well, which is great. I have a little funny story that is just a little sidetracked to this. So right before this, I took my baby outside. I'm like, we are getting sunshine, we are getting grounding, we're playing in the grass, right? I started feeling like slightly under the weather last night, and thankfully I got good sleep last night, and I took my immunity supplements last night. So this morning I felt so much better. I'm like, we're getting outside. It's going to make us even better.
Yeah.
And we're literally outside. I'm talking to her. We're praying out loud, and she starts crying. And I'm like, what's going on? And I look at her, and both of her hands are filled with ants. And she got bit all over with ants. And I don't actually have a lesson there. However, maybe lay on a blanket. I don't know.
Hide, but stay away from the anthills.
Don't put your hands in the ants. Oh, I felt so bad. That like made me feel like the worst mom at the moment. And so I would wash them and I took them all off. I put some tallow. I put some breast milk. Breast milk is always a solution. And so, yeah,
On it.
yeah, I think, like, I think I feel worse than she does now, because I keep looking at her hands.
She
But
doesn't. Probably doesn't even remember.
yeah, out of all the times though, most of the time we're outside and it's perfectly fine, and you do feel better.
Except for the once in a while,
Yep.
yeah.
Stay away from the ants.
Yeah.
Okay, yeah. And so, how can moms listen to their body and recognize when it's asking for a rest or realignment too?
Yeah. So in your nervous system, I'm a chiropractor, so I deal a lot with the nervous system. Um, you have your sympathetic nervous system, which is like fight or flight, freeze, and then you have your parasympathetic nervous system, which is like rest, digest, heal. And your body doesn't know if it's, being chased by a tiger or if your kids are out of control and you don't like you're overwhelmed from all the housework and um things work general and things like that. So your body doesn't know the difference. So I think just recognizing that, I'm in a state of like fight or flight right now. And just having the awareness to recognize that is so important. And then finding the techniques that work for you to get out of that state. So, and that's going to have a huge reflection. Again, we talked about it before on your kids' state system. And it's really good for their neurodevelopment for you to be in that more of a rest, digest, feel state.
Yep,
Yeah,
exactly. So, as we're trying to always put our kids first, you are doing that by also healing yourself.
exactly. Yeah. Hmm.
Good. Okay. And then I'm asking everyone this. So, what piece of advice do you have for our functional medicine for mom listeners out there, whether it relates to this or what piece of advice do you have?
Yeah, I think I kind of mentioned it before, but there is a lot of information out there and it can be very overwhelming. So just finding I feel like people hate to hear this, but finding what works for you is so important because what works for one mom is not going to work for you, and trusting your instincts as mom, we have like such strong instincts. And so just trusting that, like, what you're doing, what's best for you, what's best for your baby. And just allowing yourself to pursue that without guilt or questioning yourself, like, am I doing this right? Am I doing enough? Just let go of that mom guilt. We all have it. And that can be so free. Just trust yourself, I think, is the biggest thing. Like, what you're doing, what your baby needs, what you need. And I think as women, we all just need to trust ourselves more and stop doubting ourselves and questioning ourselves.
Yeah, even I think whenever a mom becomes a mom, you hear of everyone saying, "Oh, your mom instincts will come in, don't worry." And I remember myself, I'm like, "But what if they don't? What if this instinct isn't real?" But it
Yeah.
does. It really does come in, and you do sometimes have to silence the noise, whatever that is, and find, like you said, what works for you. And just like that time of being a new parent and having that come in, that's going to be the same throughout. And so trust your body. God gave you the ability to heal itself. And so, yeah, like you said, your body is already whole and already perfect. We just need to get it back to working well. Yeah.
Yeah.
Perfect. Okay, so where can listeners find you? You talked about where you practice. Where can they find you on social media? Where can they find you at your practice?
Yep. So I work at Vibrant Health Center in Golden Valley. And then on Instagram, I'm Jordan Stafford DC. I am on TikTok, but I don't really do TikTok much. I sometimes will post on it. Jordan Stafford DC.
Perfect. Awesome. Okay, I think that is all we have, so we can wrap up. And yeah, do you have anything else for us, Jordan?
No, I don't think so. It was great, Kelly, and this was an honor when you asked me to be on your podcast, I was so excited. So it's been an honor to, yeah, have this conversation with you. And thank you.
Yeah, I know I learned a lot today, so I'm so excited for all of our moms out there.
Yeah, I hope I brought a like different perspective today.
Definitely. Definitely. All right. Thanks.
Yeah.
Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.